Come in.
Hi, are you Helen?
Yes.
Hi, I'm Sarah. I'm a PA student who will be taking care of you today. Can you just verify your name and date of birth for me?
Helen Green, August 13th, 1968.
Alright, it's nice to meet you, Helen.
Thank you.
What can I do for you today?
Well, I'm just really short of breath, and I feel like I'm wheezing.
Okay, when did the shortness of breath start?
Well, I was diagnosed with asthma 2 weeks ago by my primary care doctor, but today's episode started a few hours ago when I was working on renovating my new home.
Okay. Has it been going on all day today, or has it been kind of coming and going?
Pretty much all day.
All day?
Yeah.
And you said that with the shortness of breath, you've been having some wheezing. Do you have is there anything else that you can describe it as? Like, is it like a heavy pressure in your chest or anything like that?
Not really. It causes me to cough sometimes because my throat is itchy.
Okay.
But that's really all.
Okay. Is there anything that you've tried to make it better? Like, did they prescribe anything for you for your asthma a couple weeks ago?
Yeah, they prescribed Advair and albuterol inhalers, and I tried them both, and they haven't helped today.
Okay. Is there anything that's been making it worse besides working on your house, like maybe walking or going upstairs?
No, I think it's renovating we got a 1920s farmhouse, so it's really old.
Okay.
And I think probably renovating that is making it worse, but other than that, I haven't noticed anything.
Okay. On a scale of 1 to 10, how bad would you rank your shortness of breath?
Probably an 8, just because it's not going away.
Okay. And then, are you having any other symptoms going on right now, or is it just the shortness of breath?
It's mostly the shortness of breath.
Okay.
Yeah, with the slight cough and the wheeze.
Okay, sounds good. I'm going to ask you some questions about your past medical history just to get a better look at things. Were you diagnosed with any medical conditions as a child, like maybe like asthma as a child, or was the asthma diagnosis just as an adult?
No, nothing as a child.
Okay. How about as an adult? Do you have any other medical conditions?
I have GERD, I was diagnosed 5 years ago. Okay. And then I have several allergies, which I was diagnosed 2 years ago with.
Okay. What are those allergies?
I'm allergic to pollen, aspirin, cats, mold, strawberries, and peanuts.
Okay. Have you had any surgeries where you've had to stay overnight in the hospital, or just any surgeries in the past?
I had total hysterectomy 4 years ago.
Okay. Have you had your flu shot this year?
No.
No? Okay. Otherwise, are you up to date on all your shots?
Yes.
Okay. All right. Do you have any family history of asthma or COPD or anything?
No, not that I know of.
Okay. And what do you do for work?
I am an attorney and I work in adoption.
Okay. Do you live at home with your husband, you said? Mm-hmm. And then do you have kids at home, or are they out of the house?
They're out of the house.
Okay. Yep. What do you describe your diet as?
It's okay. It's more like home-style meals, so probably not enough fruits and vegetables.
Okay. And then what about your activity level? Do you think that you're getting enough exercise?
Probably not.
Okay. Well, it sounds like you're getting exercise with renovating a house, though. But,
yes.
Do you drink alcohol or use tobacco?
I have like 2 to 3 glasses of wine per week.
Per week? Do you usually drink that like with dinner or like socially?
Usually after dinner, just
after
as
dinner?
like a relaxing.
Okay. And then have you ever used like illicit drugs like marijuana, cocaine, heroin, anything like that? Okay. And now I'm just going to ask you some more questions about your symptoms. Have you had any headaches or ear pain or sore throat?
Well,
besides the itchy throat?
No, and I would say no to the headaches or ear pain.
Okay. Have you had any fevers or night sweats or general nausea, vomiting?
No.
No? Okay. Have you had any heart palpitations or chest pain?
No, I have heartburn, but that's associated with my GERD.
Okay.
So.
All right. Well, and then also, what medications do you take daily?
I take over-the-counter Tylenol, over-the-counter Aleve, over-the-counter Zantac, and I take Premarin because I'm postmenopausal.
Okay.
I have an EpiPen for my allergies, which cause me to have an itchy throat. That's why I have the EpiPen, so it doesn't affect my breathing. And then I have the albuterol 2 puffs as needed, and then the Advair once every 12 hours, which I just started 2 weeks ago.
Okay, and then all the over-the-counter medications, do you just follow what it says in the bottle? Okay.
Yeah.
And then, again, with the allergies, so all of the allergies you have, including, like, the medication allergies, it's just a sore throat. It's not, like, a rash or anything.
No, yeah, it's just, like, an itchy throat.
Okay.
Yeah.
Sounds good.
Okay.
All right, well, is there anything else I can help you with today?
No.
All right.
Okay.
Well, I'll go ahead and talk about this with the doctor, and we'll see what we can do.
Okay.
Thank you. Helen Green is a 51-year-old female, and she comes in today with excessive shortness of breath. She was diagnosed with asthma 2 weeks ago by her primary care provider, and she was working on her old farmhouse today outside that they just bought, that her and her husband just bought, and she started having very excessive shortness of breath, and she used her inhaler that she was given, but it did not provide any relief. She's worried that the inhaler is not working. She says that the shortness of breath is not spreading anywhere, and that her symptoms are mainly just in her chest. She also has GERD that she was diagnosed with 5 years ago, and she has several allergies that cause a sore throat. Among them are pollen, aspirin, strawberries, peanuts, and mold and cats. She takes several medications daily. She takes over-the-counter Tylenol, Aleve, and Zantac, just as the bottle says to use it. She also uses Premarin for postmenopausal effects. She has an EpiPen for her allergies, and then she also has her albuterol inhaler, which she is told to use two puffs as needed. And then she also has her Advair discs, which she's supposed to use 1 puff every 12 hours. She also had a total hysterectomy 4 years ago, which is one of the reasons why she uses the Premarin. Otherwise, she's up to date on her shots. She has not had a flu shot, and because she had the flu 3 months ago. She's an attorney that, and her husband's also an attorney. It's just her and her husband who live at home. The kids are grown and out of the house. She's never smoked, and she has maybe 2 to 3 glasses of wine per week just after dinner, just to relax at night. Otherwise, she does not use any other kind of drugs. And then she also likes to garden outside as a hobby. Otherwise, she just has heartburn as an associated symptom, but she thinks it's due to her GERD, and she just has reflux a couple times a week. Otherwise, no fevers, headaches, night sweats, changes in weight, no heart palpitations, no chest pain, no nasal drippage down the back of her throat, or anything like that.